Hi, everybody. This is Dr. Dana Gibbs. And I need to make sure my mic is working before I get started really going here. Stand by. Is that mic working? Let's see. Okay. How's that working? Can you hear me? Great. Okay, perfect. Let's continue. All right. I'm Dr. Dana Gibbs, and I am coming to you today from North Texas, where I am an ENT doctor who is moving on to an integrative practice where I address both thyroid and other hormone imbalances. And today I want to talk to you about 3 ways that stress throws your hormones out of balance. So if you're listening to this and you're not a physician, please keep in mind the stuff I'm talking about is complex, especially if you're not trained in scientific language in the specific way doctors think about medical issues. Scientific proof is not nearly as black and white as people think, and in order to make treatment decisions for individual people, sometimes we have to consider evidence that's not nearly as absolute as we would like. This is where experience, advanced medical training, and consideration of the relative benefit versus risk of any given treatment comes into our treatment decisions. So this is not meant to be medical advice, and you should consult your own physician or for any medical condition or diagnosis that you may have. All right, let's talk about stress. So last week, I talked a little bit about the fact that stress can cause some of our thyroid function to be suppressed or even blocked. And today I want to dig into that a little bit more, and then look at 2 more ways that stress throws your hormones out of balance. But first, let's look at what's happening with stress, and why. If you're like most people, when you've had a super stressful day, it takes a couple hours and maybe a couple drinks to unwind enough to even interact with your family in a reasonable way. And even though you're exhausted, you might find that you can't sleep because your mind is just going 90 miles a minute, thinking about that big presentation that's coming up, or conflict with your boss, or your overflowing inbox. So, this is because of the way your body and your hormones react to stress. And the more prolonged stress is, the more pronounced and persistent that reaction gets. So our bodies evolved to handle stress. There's acute stress, like running away from a tiger. That's the cliche that's typically discussed. Um, but there was also chronic stress, war, famine, slavery. And those are historical examples of chronic stress that our bodies actually evolved to handle. And the hormone changes that happen during stress actually do help us survive all those things better. We call that adaptive. But what passes for stress in our modern world has really changed, and our bodies and our primitive brains, not so much. So, stress is anything our primitive brain sees as a threat to our survival. Stress can be internal, like pain or an injury, external, caused by circumstances, or anticipatory, when we worry about things that haven't even happened yet and have little control over. And humans are the only species that do that. And our brains react to these stressors in exactly the same way as to the more ancient stressors. But the stress reaction doesn't stay in our brain. Our body reacts to stress in a predictable way. And in mostly in our modern context, that's a maladaptive way. So maladaptive means that they're natural and normal, but they make us sick. So what's happening here? So we doctors learn about the chemical signals of stress in medical school, and we refer to this system of brain chemicals and neurotransmitters stimulating and regulating the pituitary hormones. That's another gland that's right under your brain, stimulating and regulating the adrenals and the other hormone producing glands in your bodies, such as your ovaries or your testicles. We refer to that as the hypothalamo pituitary axis, or HPA axis. So it's a complex control mechanism. So the hormones of stress come primarily from the adrenal glands, which are little fatty glands that are sitting right above your kidneys, right where they can get a lot of blood supply. But anyway, the 2 layers of the adrenal glands produce neurotransmitters like adrenaline and then hormones. The most important hormone the adrenal gland makes is cortisol, and that's the stress hormone, but it's not the only one. And all the adrenal hormones are made from cholesterol, so they're called sterol or steroid hormones. So, what does a stress reaction look like? Well, say you start to pull out into traffic, and all of a sudden another car runs the stop sign and is barreling down at you. That instantaneous electric charge that you get when your senses are all of a sudden twice as sharp and your heart is racing and time seems to slow down and you're just really amped up when something startles or frightens you, that's adrenaline, and it is released and starts acting in your body in less than a second. And it mobilizes the entire body to a metabolic high alert. And this is a good thing. It helps you react fast in an emergency, but is not good if you're at the podium about to give the valedictory address at your alma mater. The second part of an acute stress reaction is the release of cortisol from the adrenals. And this is a tiny bit slower, but the brain signals that trigger this start within 2 seconds and trigger after the trigger event happens. And within 30 seconds, the cortisol levels in the bloodstream start to rise. And once again, in a situation where we're in actual danger, this is really a helpful thing because cortisol increases blood flow and oxygen delivered preferentially to your muscles so you can fight or run. It raises your blood glucose by rapid release from the liver and by other ways, providing energy to our brain and muscles. That enables us to be focused and alert to danger. So cortisol is really necessary for life. People who don't make or have cortisol will drop dead running to catch a plane. So even in ordinary day-to-day life, cortisol helps us be alert during waking hours, regulates our metabolism, and cortisol helps reduce inflammation and swelling in our bodies. And our adrenals make other hormones as well, including aldosterone that helps us keep our blood pressure up into the normal range, and sex hormones too. Yes, in addition to your testicles and ovaries, the adrenals make sex hormones. The importance of this is something we're going to discuss again in a minute. So another result of the body response when cortisol is released is elevated sympathetic tone. So in case you don't remember what that is, it has nothing to do with sympathy. It refers to the two different and opposite parts of the involuntary or autonomic nervous system, the sympathetic and the parasympathetic. So the sympathetic nervous system revs us up for fighting or running away and makes us vigilant, fight or flight. Parasympathetic is the opposite of this: rest, digest, and heal. So sympathetic tone is a baseline state that keeps your body ready for action even when you're consciously not aware of any threats. So elevation of sympathetic tone results in anxiety, hyperalertness, high blood pressure, difficulty sleeping. So a modern example of that would be like how you don't sleep well when your child is sick or when you're on call. You probably noticed that. But then what about chronic stress, work pressure, family stress, and just the always on nature of our current society? Unfortunately, studies show your body can't tell the difference and it reacts exactly the same, except because we aren't actually running away from danger, all that quickly released energy isn't needed by our muscles. So it's now available to get packed on as fat. Sometimes we can even, in a way, be addicted to stress a little bit. Um, think about overscheduling, procrastination, being habitually late. So that boost of adrenaline that we get increases our energy and we can get addicted to that. So the other thing is that we humans are the only species that have evolved the ability to create our own stress by worrying about things before they ever even happen. So chronic thoughts about, what if I get cancer? What if I get robbed? What if I can't pay my bills? Why me? Worry results in just as much stress as if the bad situation was actually already happening. So there are three things that elevated cortisol can do in your body in addition to those direct effects of the cortisol itself in your body. Um, and those direct effects we talked about: fatigue, irritability, headaches, intestinal problems are a couple, anxiety, depression. weight gain and increased blood pressure, difficulty recovering from exercise and poor sleep. But there are more because cortisol and the chemicals that control cortisol, such as ACTH, which this is a pituitary chemical that signals your body to make more cortisol. ACTH in your pituitary actually suppresses TSH. It feeds back on your brain and tells it to suppress TSH. And TSH, if you recall, suppresses thyroid hormone production. So it directly suppresses it. But elevated cortisol and stress also suppress thyroid function. Similar to your body going into hibernation, drops your metabolic rate. This is because your body can't tell the difference between a calorie restricted diet and actual starvation, for example, or being stressed out because of your stressful job life, or from an extreme illness or injury where it needs to conserve energy or die. Which, if you aren't actually sick or starving, makes it even harder to manage your life, of course, because it adds chronic exhaustion to the things that are causing you to be stressed out in the first place. So the way it does that is by triggering production of more reverse T3, which we discussed last week. Reverse T3 is a competitive inhibitor or a blocker of T3, which is the active thyroid hormone. All right, so thing number 2 is insulin sensitivity. So remember a few minutes ago when I said that the stress reaction raises your blood glucose? What does that by decreasing your sensitivity to insulin. And the reason that's helpful is because your muscles, when they're active, they don't need glucose to do what they do. So raising your insulin, decreasing your insulin sensitivity, conserves the glucose for your muscles. However, so it is helpful in the immediate term if we actually need to run or fight, but it's harmful when it's prolonged because lower insulin sensitivity means your insulin levels increase and eventually your blood sugar increases with all the problems that cause. We don't have time to go into all the things that high insulin does to your body, but keep in mind, insulin is also a hormone. And so high insulin is a catabolic hormone. It's a growth hormone. So it grows your fat cells. It can grow cancers. There's a couple of other things that high insulin levels directly do: chronic anxiety, depression, menstrual irregularities, and PCOS when it interferes with your sex hormones, and then heart disease. And then it can also feed forward to force your cortisol to go up even higher. So another thing that it does, high cortisol does, is that it triggers chemicals in your brain and body to cause something called neurogenic inflammation. That is to say, an increased perception of pain or just aches and pains in your body. It's kind of like your body is trying to make you pay attention and retreat so that you can live to fight another day. And then there's some other things. So let's use the analogy of a factory for what's going on in your adrenals. So your adrenals are the factory, and your adrenals get orders from your brain, and the pituitary chemical ACTH signals an increased production of cortisol. So if you think of this factory as a car factory, maybe that also has the capacity to make tanks. And as the government orders more and more tanks, the factory no longer has the excess capacity anymore to make convertibles or station wagon, and eventually runs out of the capacity to make even sedans. So the other orders get canceled. And by the other orders, I mean the other pituitary hormones like TSH. You've heard of that one, of course. We already talked about it. Growth hormone. I can bet that you can guess what that does. And then gonadotropins. Okay, so these are FSH and LH, and they are what stimulates your ovaries and your adrenals to make the sex steroid hormones. So if you suppress FSH and LH, then you also suppress your sex hormones. which means that you also are going to end up with loss of libido and all of the other things that go along with low sex hormones, irregular periods, PCOS. There's all kinds of different things along with the poor function of sex hormones. So all those other hormones get knocked off the assembly line, so to speak, in favor of keeping the tanks coming. Another thing that in our factory analogy is that eventually, when your adrenals have been running at high gear, making cortisol all this time, eventually your adrenals start running out of the raw materials to make the steroid hormones and start rationing in favor of keeping cortisol, because remember, we have to have cortisol to stay alive. So the result is it messes up the sex steroid hormones even more. And it can slow or stop that. And then once that's completely gone, it can even stop making aldosterone too. And that's when you can get low blood pressure and start feeling fainting spells. So I'm sure that you probably have heard of Olympic athletes or really serious professional athletes who have lost their periods. And that is exactly what's going on in their case, is their body is busy pumping out cortisol because they're stressing by training. And then they lose the ability to make the sex steroid hormones. And then finally, chronically elevated sympathetic tone that we talked about, that's not really a hormonal effect, except in the way of if your cortisols get stressed enough and lose their ability to even make enough cortisol, then sympathetic tone stays elevated, but it stays elevated by using adrenaline instead to keep you, helping you react to these recurrent acute stresses. And this produces anxiety, a chronic level of anxiety and hypertension. So very interestingly, another fun fact, when a chronically stressed mom carries a pregnancy and she is stressed throughout the pregnancy, the baby will be born with a larger amygdala. And the amygdala is the part of the brain that sees threats and helps us identify threats. So if your amygdala is larger, then you will start to see benign things as threatening. So this baby that will be born with a larger amygdala will be basically chronically anxious too. So the more stress we endure, the more we overuse our adrenals, the longer and harder the adrenals work, the more tired and depleted they may become. And when the adrenals can't produce enough cortisol to meet our needs, then we get problems like chronic fatigue syndrome, fibromyalgia syndrome, PTSD. So anyway, the overarching theme, is the loss of the ability to handle stress. And many of these symptoms are hallmarks of burnout. So burnout is not just a mental thing, it is a physical and hormonal thing. So next week, I'm going to talk about some fixes you can implement to manage stress and improve your adrenal glands' ability to respond appropriately to stress. All right, so if you're a physician listening to this and you need to discuss a patient with me, I do also offer consultations, and you can email me at Dr. Gibbs at danagibbsmd.com. If you're a thyroid or a chronic fatigue sufferer in North Texas and you want a caring doctor to really help you finally resolve your exhaustion, frequent illness, joint muscle aches, menstrual irregularities, and poor sleep issues, come sign up for a new patient appointment with me now at www.danagibbsmd.com. All right, everybody, thank you for listening, and I'll talk to you soon.